As healthcare costs increase, a new report shows many hospitals in North Carolina are not doing enough to help those who can't afford care.
CBS 17 Capitol reporter Michael Hyland is in Raleigh for us tonight. Michael, state officials say that's happening even though the hospitals are getting significant tax breaks.
And the state treasurer's office says many of them are not doing enough to justify that, but hospital leaders are pushing back. After the pain that lands you in the hospital can come the financial pain from the bills.
All of that profit was made on the back of a sick person.
State Treasurer Dale Folwell released a report Wednesday critical of North Carolina's nonprofit hospitals. Working with researchers at Johns Hopkins University, they found hospitals across the state got more than $1.8 billion in tax breaks last year. But for most large hospital systems, their spending on charity care did not go above 60% of what they got in tax breaks. Folwell's office oversees the state health plan for nearly 750,000 state employees and retirees, calling the costs unsustainable.
There should be no excuse, given the fact that we are the largest customers of all these entities, that we should not be getting higher quality, higher access, and lower cost.
My emergency room visits were over $25,000.
Christina Persico recently told me about being uninsured and trying to get charity care.
It's a lot of paperwork. You have to get a lot of documentation. You have to turn it all in. And it's a really lengthy process.
The North Carolina Healthcare Association, which represents hospitals, said the data doesn't include spending on areas like preparations for disasters and pandemics. They also said hospitals submit financial information to regulators to maintain their nonprofit status. Folwell says the hospitals also need to have greater transparency in pricing.
Consumers of this state have not, will not, and will never be protected as long as this occurs.
Officials at Duke Health pointed to the work that they've done during the pandemic with mass vaccinations as well as testing and treatment sites. The treasurer says there is no state agency overseeing how much hospitals spend on charity care and that there needs to be more accountability. Live in Raleigh, Michael Hyland, CBS 17 News.